Take a picture of me outside.
Okay.
Thank you very much.
You're
Thank
welcome.
you. Have a good day.
You
Good luck
too.
with your meeting.
Oh, thanks.
Give us a second. We'll just be with you in a second. Can you guys hear us?
Yes.
Yes.
Can you hear me now?
Yes.
Check 1, 2, 3. Can
Yes, I can hear you.
Okay, good. I think we are back in business then. Okay. We'll stand at ease for a second again. So just for everybody's information, people cannot hear us speaking on YouTube, and that's why we just want to make sure that the 5 people who listen to us usually can listen to us. All right, we are back in action again. So for benefit of anybody who was not able to listen to us, we had the chair's remarks, which were just saying that we want to get it started, and we are on item number 1 on Roman numeral 3, which is Senate Bill 93. Motion was made by Representative McCarthy-Vahey and seconded by Representative Martinez. And I was just going to give you a little bit of an update what this bill is. This is the governor's bill. And the JFS language just looked at and adjusted some of the definitions. It's about workforce and nurses' aides provision. It's also about rural health transformation accountability and EMS interstate licensure compact. If we have no questions, we can have a roll call vote for this. Madam Administrator, can we have a roll call vote for this, please?
No questions online,
And votes will be held. We'll let you know after everything when we do our votes. So we're ready for a roll call vote.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory,
Senator McCory votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara Desdichia,
Clara Desdichia votes yes.
Representative Berger Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Jenga,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Hockedal, Representative Cavers DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Paletta votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Romano,
Romano votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis? Yes. Thank you, Mr. Chair.
Thank you. That brings us to item number 2, which is Senate Bill 190, an act authorizing certain foreign educated veterinarians to practice under a temporary permit. And this is a proposed JFS with a JFS LCO 2378. Do we have a motion to?
So moved.
All right. Is there a second? Second. So moved by Senator Summers and seconded by Representative McCarthy-Vahey. Let me give you a little bit of a background. This is, we had a public hearing on this topic. There are 2 parts to this bill. One of them is about a mirror bill for New Hampshire, where because there's a shortage of veterinarians at this time, the idea is if there's a foreign trained veterinarian who has gone through the training and pass the exam. There is a clinical exam that takes some time. The waiting time in Connecticut is about 2 years or so, and then that's what this bill, JFS language is, to include 2 years time for waiting. And for the clinical exam, the other part of the bill is about telemedicine. The telemedicine part is, we already have telemedicine for veterinary medicine, but for new patients, in this case pets, you would have to have a evaluation performed. In this particular bill, what we are saying is that if there's an emergent issue, the veterinarians can see somebody for telehealth, so to be able to prescribe medicine for less than 14 days treatment, with the understanding that that patient will be seen in the office once the treatment has been initiated. So that's the background of this. Do we have any questions? Yes, Representative Carpino.
Thank you. I like the language in the bill. I just want to run through a couple of things for legislative intent because the substitute language is so new. So if my dog has an urgent need and our first visit with a new vet is via telemedicine, if you could just walk through how the required prescription or medication will be filled since it is a new patient to that particular provider.
Thank you for that. So the way it would function is it would likely be not for a chronic illness, but for an acute issue. And for that acute issue, the call will be made and a telehealth visit would be initiated. And let's, for the sake of a conversation, assume it's a rash. And then if that dog has a rash and that needs a treatment, the veterinarian will see that patient and would be able to prescribe the medicine, probably for 7 days, but maximum 14 days. And then meanwhile, they will say that we need to see the patient, and they will try to get the patient as soon as they can, but you'll have a 14-day window or maybe even longer if necessary, so that there's a real care established.
Perfect, and that's what I was hoping you were saying, and I just wanted to make sure that we worked through that. And in the event, taking your example, the dog gets bit by something, has a rash, the doctor, the veterinarian is able to diagnose that appropriate, gives a 7-day prescription, and the animal doesn't need follow-up because it is a pretty straightforward case. If the animal has another urgent need, 4 months down the road, is the individual allowed to take their pet to another telehealth visit, or would it require an in-person visit at that point? For a completely separate issue, also urgent. I hope the answer is that they can still use telehealth, but I just want to be clear.
In that particular case, they should have seen that patient in between for a well visit or whatever reason, so that there's established in-person care. So the idea is that you would not get all emergency care through telehealth. So you need to have established relationship for in-person care.
Okay, well, I appreciate the intent, and I will vote for this today because I appreciate what we're doing, and I think it's positive. I do think we might need to work through that because some of these issues might not require follow-up care and might be properly addressed via urgent care, particularly if you're maintaining the relationship with that particular physician. I have learned over the last year that puppies are no different than children and don't often come down with things during the normal course of the working day. So I would like to be able to work through reducing any obligations for the vets to actually have to go through their records to make sure an in-person visit has taken place before a completely separate and appropriate urgent care has popped up. Again, happy to support this today, but think we probably need to work through some of that.
And so as of right now, the law in the state of Connecticut is that if there's an urgent issue, the patient will not be seen via telehealth. They would have to come and see, and they would have to wait. So we are opening that window, but at the same time making sure that we have taken this step while we are trying to navigate the people who were uncomfortable with the bill to find that common ground so that the patients would get the care in a timely fashion, but not necessarily bypass the patient-physician relationship in this case.
And sir, I completely agree with that. I just don't want to see a pet parent start vet shopping for their urgent needs as opposed to establishing a relationship. So I thank you. I appreciate the intent. I support the intent, and we'll take a closer look as this makes its way.
Thank you. Representative Claire Destuccia.
Thank you, Mr. Chair. And to follow up on what Rep. Carpino said, once I see said telehealth vet, will I have to follow up with that same telehealth vet, or can I follow up with any other in-person vet? Do we know?
In this particular bill, the vet who provided the treatment is the one that should be followed up, or that practice.
And will there be the ability for these telehealth vets to only be telehealth? Like, they have to actually have a brick and mortar building? Or I'm just concerned that we're going to get like a telehealth vet company and they'll only be telehealth.
That's a fair question. I think because of the requirement for them to be seen in person, they would have to have a facility to be physically examined, that patient.
Okay, and that brings my next question, I'm sorry. How will we monitor that follow-up? To Rep. Carpino's question, if I go to you as my vet and I need to follow up and I don't, I can just go to another telehealth and no one's policing it to know that I went to someone else before that would say, well, you should have followed up in person. And this could be things that need to be worked out, but I wanted to.
So just like any other case, we have Department of Public Health, which will not be directly observing every interaction, but if somebody's not following the law, they would have to follow up and face the consequences.
Okay, thank you.
Thank you. Seeing no other questions, Madam Administrator. Oh, wait, sorry. Representative Claire Teacher.
Thank you. I'd like to make a motion to start a consent calendar and add this.
Oh, perfect. And we don't need a second for a consent calendar. We just move forward, right? So we have a consent calendar, and item number 190, that is number 2 on the list, is on the consent calendar. That brings us, should we put all the ones on the consent calendar right now?
Let's hit the pause button on that.
I'm so excited to get it over with. Okay. All right. So next item is Senate Bill, number 3, Senate Bill 191, an act concerning the psychedelic assisted therapy pilot program. And this is a JF to the floor. Do we have a motion?
Moved.
Moved by Senator Summers, seconded by Representative Kristen McCarthy-Vahey. With that, let me give you a little bit of a background. This committee had passed this bill a few years ago, and this comes to us through Senator Marks this time. In the past, this committee had passed a bill which became a law with some funding that was associated with it to have a research study for veterans with severe PTSD or severe depression to go through this treatment. At that time, the language had said that till this bill has gone through till the patients were going through the treatment, this was only if it was not approved by the FDA. There's a chance that psychedelic medications for this purpose will be approved by the FDA, which makes the research study stop if we don't make a change in the language. So that's the main purpose of this. And it is not making any medicine or thing legal. It is not creating anything outside of what the FDA. It is just saying that the research will not stop, so the patients who are enrolled would continue to get the treatments that they are hoping to continue to get. And also in this pilot, we may have expansion of the number of people who may fulfill the criteria, even if they're not veterans. So that's the broader rationale for this. Any questions? Yes, Representative Mara.
Thank you so much, Mr. Chair. I know we had some discussion on this last time, and I've had some time to contemplate it a little bit more. So my understanding is that if psilocybin, which I think has had really good results in its phase 3 trials, if it comes out and goes through the FDA process and is approved, this drug will then be approved to be used legally and paid for by people's insurance companies. So I guess my question to you is, why are we, it seems like this is a funding thing. Why would we intervene on funding from the state level instead of letting people go through the process through their normal medical care and getting this funding that way. That's kind of what I don't understand. I feel like we're taking over like an insurance process here.
Thank you for that question. And I think I did not mention that there's no funding associated with this bill. This is part of the research, so we do not want that research to stop. So those patients are already enrolled and they're being closely followed to see the impact. And as a result, because of the wording of the previous law that we had passed, the research would automatically stop. And then that's the reason we want to be able to continue the research project, and this is time limited, and it is not associated with any funding. But if it's FDA approved, then a new patient or that same patient after the study is completed would have that opportunity to get the treatments as required.
However, if it is FDA approved, there's a continuing for phase 4 trials. So is this outside of the studies that are being reported to with the drugs that are going through the FDA process? Is that what we're doing? Because if it's going through the FDA process and they've concluded those studies and then they've submitted for their R&D, I don't understand what this is doing. I mean, it's either going through the FDA process or it's doing something outside of the FDA process.
So this is not an FDA study. And the rationale was that veterans were committing suicide on a very frequent basis, even in our state. And the initial data had shown that we could save their lives. And that was the reason that we were able to put some resources to save as many lives as we could, because the FDA process is slow. And so this has the FDA-based criteria for the study, but it's not an FDA study, and we do not suggest as a body, as a public health committee, that we wanted to go outside of the FDA guidelines. So the studies are within the FDA guidelines of the FDA studies, but they're not part of the FDA studies. But the studies are still undergoing, and we don't want to stop them till the end of the funding, so that we do not stop the treatments for the individuals. And it's not FDA approved at this time. But should that happen, we do not want to have anybody have a negative outcome. And this is protecting our veterans for that very purpose, and also the study process that is underway in our state.
I'm not sure I understand how that protects our veterans. If it becomes FDA approved, then the veterans can move over to an FDA approved drug that has had sufficient studying behind it. You're saying that right now this is a drug that is not going through the FDA process, is not seeking FDA approval, therefore will not be an approved drug. And so we're going to be offering our veterans a drug and a study that doesn't have as a robust study as the ones that have been approved. I think that actually is to a detriment of our veterans and people that are at risk. I feel like they should be moving then to the drugs that have the proper approval, that have gone through the safety regulations and have the data to support it, instead of continuing them on a program that hasn't gone through that rigorous step. This to me seems like a detriment to our veterans, instead of pushing them to something that we actually have proof here, this is what works, it's similar therapy, but this is how it should be done. But instead we're saying, no, keep on something that's not gonna go through the FDA process. That to me doesn't sound like it's a service to our veterans, with all due respect.
Thank you so much for your comments. I think this came to us because of the concerns raised by the veterans, but also the clinicians that are providing them the care. They felt that there was going to be a period where they may not be able to continue the treatments, and that's how they assess this. So I would leave it up to the clinicians to identify if it was detrimental or not. They felt it is, but they're the ones hands-on providing the care, so I have to respect their views. But I hear what you're saying. Before you, there are a couple of people online. Do you mind if I take them? Representative Zupkis? Okay. Senator Gordon, followed by Senator Summers and Representative Zupkis. Senator Gordon, you're on.
Yes, thank you, Mr. Chairman. And I do share the concerns raised by Representative Mara. We do have some studies that have come out Comp 005 and Comp 006. And in fact, it's noted, not just by the company Compass Pathways, but by even FDA itself, that there's going to be a process later this year because there's a seeking of an FDA approval for one of the drugs that Compass Pathway has studied and makes. So I'm just concerned that if these are studies that the state has funded and wants to continue, I understand the intent, but I'm concerned with regards to wanting to expand and continue it if there's already a process in place via the FDA. And if the FDA were to approve this, then I don't see why the state would have to be further funding and managing a pilot program. That all then gets handled post-approval by the FDA relative to people accessing insurance coverage, all that type of stuff, how things get handled by healthcare professionals who take care of people who might meet criteria for the drug. So I'm very concerned about the state wanting to expand something more, especially in light of studies come out that showed some benefit, albeit some parameters were modest benefit. But again, there's a process with the FDA, and that's my major concern, not trying to help people, but trying to do something outside of an already an established national process and protocol with the FDA. Thank you.
Thank you. Senator Summers.
Yes, good afternoon. I just wanted to make sure that everybody was aware that this psilocybin is actively undergoing FDA approval right now in the synthetic formulation of treatment for resistant depression. And they've had very good initial clinical results, and therefore they have classified it as breakthrough therapy, which gives it a accelerated development schedule and review process for the drugs. And they only do this for drugs that show substantial improvement over existing and current treatments. So I might feel a little bit differently. I feel that this will go through FDA and will get approved for certain indications. But in the meantime, we heard in previous years, and specifically previous years, the breakthrough results that have been witnessed by our medical doctors at our VA, specifically for our veterans that are suffering with severe PTSD, and how one or two treatments has absolutely changed the trajectory of these veterans' lives in a very controlled environment. And I'm concerned because even if we are on the pathway for FDA approval, and it has breakthrough therapy. It's been designated as a breakthrough therapy drug. However, by the time we get the approval, which I think they're estimating around 2027, by the time those drugs then get on formulary with insurance companies, that is not quick. As soon as you clear a drug, that doesn't mean that insurance is going to pick it up on their formulary. So I'm concerned about the people that are currently in this study now, and I would like to see sort of the continuum of care in the study. So I am going to support this today. I think it's important. I will say that the FDA has, greenlit or authorized phase 2 trials for this, especially to treat alcohol or PTSD in veterans and first responders specifically. So I think I'm going to be supporting this today, and I wanted to just make sure everybody knew the information that I had. Thank you.
Thank you, Representative Zupkis, followed by Representative McCarthy-Way.
Thank you, Mr. Chair. I agree with what my colleagues have stated, but I have one question, because we're talking about veterans. Senator Summers just stated first responders also, but in this bill, it says allow for any adult. That's just not veterans and first responders.
That's so the historical the individuals were veterans, retired first responder, and direct care healthcare workers.
But if I might be mistaken, but this says any adult along with those people. So we're not talking a specific group of people, we are talking anyone.
Yeah. With the clinical conditions. So refractory PTSD and depression.
So why is the pool expanded?
That was a request made by the clinicians and the researchers working on this to expand that. Thank you.
Thank you.
Representative McCarthy-Bay.
Thank you very much, and I thank the good representative for clarifying that that is one of the changes that we are making in the bill. And just also would love to point to some of the testimony online that we received. And I know Senator Marks is not here today, but she's been a champion, and she has reminded all of us, or actually I should say invited all of us to come visit and see the work that's being done. But I think important to note, and I'll just quote his testimony, that unlike daily oral medications, psychedelic-assisted therapies are labor-intensive in-clinic treatments. And I think back to the discussion earlier, even as we're going forward at the national level with that FDA approval process, these researchers are hoping that we can continue, as Senator Summers referenced, help bridge that time period, that implementation, and that gap, and continue to gather the data and also the understanding of how we best implement that here in the state. So I will be supporting this as well.
Representative Zupkus.
Thank you for the second time. I just wanted to say that I am all for and have heard over the last few years about how this can change veterans, and I am all for that. However, today I am going to be a no, because when we say any adult, that's anyone over, is that 18? And I'm concerned about that at this point. I think until a study is done and we see the results and it's FDA approved, you know, I can put my kind of feelings aside to help someone out and make a difference in their life drastically. However, when we open it up to any adult, which is anyone over 18 at this point, I am a little concerned about that. So for today, I will be a no to flag it, and hopefully we can have some further discussion about that piece of it. Thank you.
Thank you for your comments. Seeing no other comments, Madam Administrator, can we do a roll call vote, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory,
Senator McCoy votes yes.
Senator Summers, Representative Clarice Detrier,
Yes.
Representative Berger Givallo, Representative Biggins, Representative Carpino,
No.
Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Jango,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Harkadel, Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletta,
Paletta votes no.
Senator Rahman,
Yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
No.
Thank you, Mr. Chair.
Thank you. We'll keep our votes open. We'll let everyone know for how long. We'll keep you guessing. Next item is item number 4, Senate Bill 193, an act establishing licensure for long-term acute care hospitals. We have a JFS language, LCO 2380. Do we have a motion?
So moved.
Moved by Representative Kristen McCarthy-Vehy and seconded by Representative Claire Desteacher. And a little background of this. This bill is a bill we have heard before. The whole concept is that the federal government has an LTAC, long-term acute care hospital designation. There are 2 LTAC facilities in the state of Connecticut, and because the state does not have a licensure category for this, that has been part of the hurdle for various parts of their care and reimbursement and management and services. So this bill is trying to create that category in sync with other states, but also in sync with the federal licensure categories. The LTAC, the LCO information is just fixing the background check that would be necessary if there's a category change that would be created. So it's allowing us to be in sync with safety for all the patients who would receive the care. With that, Representative Claire Desteacher.
Thank you, Mr. Chair. I'd like to add this item to the consent calendar.
So with nobody is concerned, so we move to put it on consent. And next item is item number 5, which is Senate Bill 195. It's an act concerning the prevention of accidental overdose deaths and improving access to treatment and recovery services for substance use disorder. We have a JF language. Do we have a motion?
So moved.
Moved by Representative
Second.
Kristen McCarthy-Vehy, seconded by Representative Kitt. I can give a little bit of a background. This is a bill that has come to our committee before a few times. This is making sure that individuals have overdose protection and then pathways for recovery by wraparound services to positively impact their ability to survive, and then hopefully get wraparound services and support systems so that they can move towards rehabilitation. We have had a pretty robust public hearing on this topic. We can take any questions or concerns, or we're going to put it on consent. Representative Claire Desteacher.
Thank you, Mr. Chair. I know my friends on this side of the aisle have a lot of concerns, valid concerns about this. I think everybody can agree that we want people to recover, to go back to a productive life, and we don't want anybody to die. But part of that problem is passing a bill, just the testimony saying that it's to prevent deaths, and so people aren't, quote, shooting up in the park. Though we don't want that, and we don't want people to die. We don't want people to get high in the streets. There's no data, or at least no one's been able to provide us with any data that all these people they've taken into these recovery centers, how many people have gone on to recovery, that have gone into rehab. So I think that's a large part of our issue with this. I know other people have different issues, but that's where we're coming from, and at least myself with this. And we'd like to try. We all love the wraparound services. We want this bill to move forward. I know without the safe injection piece, but we'll see where that part brings us moving forward. Thank you, Mr. Chair.
Thank you for your comments. While I respect your perspective on not supporting this today, just for the people who are listening, the probability of rehab is 43% based on the data, so that people at least don't get the information. If you look at the various testimonies, you'll see that as well. This is also published from Vancouver, and now we are seeing the patterns in New York, where the recovery rates are there and improving, and also from Rhode Island as well. With that, Madam, sorry, Rep Mara, sorry about that.
Thank you so much, Mr. Chair. As many of you know, I too have been out in front of this issue and believe it is something we need to tackle. And I have been very strong in my words on that. And I have visited the safe injection site places, and I have seen some of the great work that they've done. I also know that the wraparound care that is provided, I realize, and maybe people don't realize that when we look at recovery with people that are suffering from addiction, it's hard to get someone from that state of using and being consumed by the need for drug use, and then to a place of recovery. And so many times, all the things that we do, it doesn't necessarily shorten that time. So a lot of our efforts have switched, and that's why I'm on board for having this harm reduction, because you really have to get someone from point A to point C, right? And B has to be supporting them along the way. But I don't think that right now, where we are, the safe injection site is a place for Connecticut. I don't believe that having 4 approved in this bill is going to be a place that we're going to be able to move forward with. And as much as this is something I want to see, I don't think it's the time and the place for it now. However, we know that having those harm reduction units can still save lives, and we've not seen any evidence of harm reduction unit versus safe injection site. So with this, Mr. Chair, we have an amendment that I would like to ask the clerk to distribute, and I be allowed to summarize.
Please go ahead.
So our amendment to this would be that we strike the language and then add in not later than January 1st of 2027, DEMIS, in consultation with DPH, shall establish the pilot program to prevent drug overdoses through the establishment of harm reduction centers in 4 municipalities in the state. And so what this basically does is this moves, right now we have harm reduction units that we have approved, but they're not going to be fully funded until July of 2027. So this takes those harm reduction units and it moves that approval up to January. And it also takes the 3 units that we have in statute and it increases it to 4 units. So I'm a strong believer that these harm reduction units are a way that we can move forward, and I think that this can get us probably 95% of the way there. No one here that brought forward information ever said that a community, never did a comparison of a community with a harm reduction unit versus a safe consumption site, right? They did a community that didn't have anything and a safe injection site. I believe that we can get 95% of the way there if we support these harm reduction units and we get these done, because right now we don't even have them updated until July of 2027. We can move this forward and we can actually make a difference here in the state of Connecticut instead of trying to have something that's controversial that might be kicked out again. Like, I really want to see something done, and I believe this is a way we can move forward. I ask for a roll call vote, please.
Thank you so much. Can I just clarify something? Are you suggesting that there should be two things happening simultaneously, that there should be a OPC but also harm reduction center, and see the difference in outcomes? Because that would almost be unethical from the current status and the data that we have.
No, this would strike the OPCs. This is going back to the original language of the bill, and this is just creating the harm reduction units and making sure that they're fully funded sooner than like we passed the harm reduction units a couple years ago. And so this would make sure that they're fully funded sooner. And this would increase the amount of harm reduction units that we could see. What I'm suggesting is that everyone that came in and testified and said, studies show, studies show, studies show, they didn't say studies show OPCs over harm reduction units. They just were saying studies show that harm reductions with a safe site is better than nothing. But we know that having wraparound care is a big bulk of what these sites actually do. So I'm saying, let's push forward and let's make something happen. And let's make something happen even better this year, instead of risking, putting the OPC out there again and having it risk being shut down again. I want something to happen here in our state, and I believe this is the way that we can do it. And I believe we can get buy-in across the aisle, top to bottom.
Sure, and I just wanted to clarify. So you mentioned funding, but the amendment does not mention funding. Maybe I will need to read it again.
Yeah, Mr. Chair, this is current law as we have it already. So it is already currently put in for July of 2027. So that is already as it is. I'm just saying that we move it up, we make it quicker, and then we add in the fourth municipality. Is section 17A-673C.
Okay. Some of my colleagues have some questions, and I do too, but I'm going to actually first have my co-chair, Representative Kristen McCarthy, he ask a question.
Thank you very much, Senator Anwar. And really just a comment more than a question. And I appreciate the intent and actually very much appreciate the good representative's willingness to understand and to invest in assuring that we have the support and services that we need here in the state. My concern with the amendment is largely based on what we've heard at the opioid settlement advisory committee and elsewhere in the research, is that the majority of people who are dying as a result of overdose are using alone. And that is one thing that our harm reduction centers are unable to address, and the opioid prevention centers would be able to address. So for that reason alone, I think there are some estimates, I believe, and I have to double check my source, but I believe it's close to 60 to 70% of folks who are dying are alone when they are using. And part of the gift and the strength of the overdose prevention centers is that there is someone there then to save them, which I know the good representative is well aware. So for that reason, I will not be supporting this amendment and ask that my colleagues vote no. Thank you, Mr. Chair.
Thank you, Representative Claritas Jeter.
Thank you, Mr. Chair. I'm in strong support of this amendment that Representative Mara put forward. We know with harm reduction centers, they're not just focusing on stopping abuse, which substance use, which they want. It's the wraparound models. It's what they do. What are the underlying drivers? Trauma, housing instability, mental health, medical issues, unemployment, and social isolation. And by adding 4 in the state of Connecticut, let's use these. Let's get these up and running and see what they can do to help the residents of the state of Connecticut before we go ahead and put in the overdose prevention portion of it. So, Mr. Chair, I will be supporting this, and I hope everybody else does today. Thank you.
Thank you so much. I just wanted to make one more quick comment. I wanted to thank Representative Mara for her investment in this issue, and then also taking the time to visit some of the sites and be supportive of the community that is impacted by this. I just want to mention that this is already happening. So in our state, we already have a law and a bill that is addressing this, but the OSAC funds are being used for this very purpose every day. So this is a kind way of approaching this, but this is already happening, so it does not necessarily change anything. The issue is that people are dying, and this does not necessarily solve that. So I see Senator Summers has her hand up now too. So Senator Summers, please go ahead and then I'll complete after that. Senator Summers.
Yes, thank you. I fully support this amendment. I think it's a great interim step. And I think the accelerated idea of putting in more of these centers is a positive one. I do not agree with the ability to inject street drugs at these facilities. And the other thing that I just want to be cautious of is I just want to make sure, and maybe the proponent of the bill could speak to this, that communities get to decide if they would like to host one of these centers or not. I would not be supporting having a center forced on a community that was not willing to receive it openly. Thank you.
Thank you. So we are on the amendment, and with that, I would just join my co-chair. Oh, Representative Martinez, sorry.
I just wanted to point out, I remember one of the testimonies from last year on this really stuck with me, and they were talking about the opportunity to offer services and extend that branch when people were ready, and how people would come in and they would take a shower or feel human and develop that relationship, and that was part of how they were able to discuss further services. So I don't believe these centers in any way would stop any wraparound services, and I definitely agree wraparound services are needed. I just think we need something in place. I know working in the emergency room for years, unfortunately, a lot of these people have a stigma, and they'll come into the ER and they'll kind of be looked at as the frequent flyer and things of that nature. So to have a place where they're treated with respect, to be able to develop that relationship, I think will be really important to saving lives.
So Representative Mara.
Thank you so much. I appreciate your comment, and that is my sentiment too. That is exactly what this does. That's what the harm reduction unit does. People come in, they can get the fentanyl testing strips, they can get new needles. They're there, they can, in these harm reduction units, there's a place that if they're frazzled, they can go lay down for a while. They can have therapy care. It's that touch base within the community. So it is everything there except that part where it's the consumption. It's everything else. And this is in law, yes. However, it's not funded yet. That's what this does. It moves the funding forward, and then it increases them. It increases it from 3, which is in statute, to 4. So I think that sometimes we want to jump in and go all in with everything, and we forget that there's a process of getting there. And so we're going to try to jump in, we're going to go all in on this, and it's probably going to get vetoed again. Why can't we make a step along the way to get this a little bit forward? And once it's in these communities, once the funding is there, maybe people will be a little bit more comfortable with, oh, well, maybe we can move to this, or maybe not. But in any case, we'll get some help sooner, which is really where my heart is with this, that whole wraparound care that we can do sooner rather than later. Let's push it to get done sooner. Thank you. Thank you.
Representative Kidd.
Thank you, Mr. Chair. All I can want to say is that in 2025, there were over 774 confirmed drug overdose deaths here in Connecticut. And I absolutely believe in harm reduction units, but those are over 700 people who died. I don't know what percentage of those could have been saved by an OPC, but it would be more than 0. And I think any life that we can save and any family we can save from suffering those horrible losses, we should be trying to help. That's not to halt the harm reduction units, it's a yes and. And I think we have enough data, international and domestic data, to show that these centers work in preventing deadly overdoses. And we can't help people once they're dead. So I will be voting against the amendment, but for the bill. Thank you.
Sure. Representative, go ahead. Carpino.
Thank you, Mr. Chairman. I hear a lot of the same things. not everything, but a lot of similar things from my colleagues around this horseshoe. But we've been talking about this since 2022. Sir, am I correct that none of these harm reduction centers are actually open yet?
There are multiple that are open. So there's a Connecticut Harm Reduction Alliance that has multiple sites. There's a van that is across the state. There's also a Liberation Program that is there. So there are multiple different sites. Demas has been providing them care. So this is already in action every single day in our state of Connecticut.
So thank you. How many new ones have come into fruition since we passed this law in 2022, sir?
I don't have the number, but because of the OSAC funding, because we have been able to get some fund thanks to the Attorney General's efforts, we have far more in communities and towns now.
And I appreciate that, because I don't know anybody in here who said we don't want to help people, that we don't want to reduce the number of overdose deaths, that we don't want to provide wraparound services, we don't want to provide wound care. Everybody has said we want to provide wound care, we want to provide counseling, we want to provide a safe place to reach out for guidance. We want to provide opportunities to obtain Narcan. We want to provide an address for folks who are looking to re-enter, if need be, the labor market. What I keep hearing is that there's some disagreement about safe injection sites. So I just really want to put it clearly on the table that that seems to be the only provision where I hear disagreement here. I appreciate this amendment. I want to do more, and I want to do more quicker. I want to cut down those numbers, but we don't know how many of those unfortunate families who have lost folks that are going to utilize safe injection sites. But I'm willing to bet that the quicker we can get more harm reduction centers up and running, the larger impact we're going to have on all of our communities, because this problem exists across the entire state. This isn't limited to 3 or 4 or 5 communities. This is a community issue for all of us. There shouldn't be stigma, because substance addiction doesn't know color, doesn't know social economic status, doesn't know family structure. But I keep hearing that we agree on everything but one item. It's a short session. We have a limited amount of time to do the most good for 3+ million Connecticut residents. I want to add my support for this amendment. It's going to do more, and it's going to do it quicker. So I appreciate the amendment, and I will be supporting it.
Thank you so much for your comments. Just for the benefit of people who are listening, the Connecticut Harm Reduction Alliance was created in 2014. The wraparound services were initiated back in 2014, and they have been increasing on a regular basis, and the number of centers are already there. The OSAC funding has allowed this to be in all different communities across the state. So this amendment is asking for one more to be created, as opposed to the fact that they're already everywhere. But despite the fact that the harm reduction work has been going on since 2014 in our state, one of the first states in the United States that this has been happening. And just from 2019, when I was elected, and then so was Governor Lamont, 9,000 of our citizens have died. 9,000, with all of the wraparound services since that time. So it's important to note it isn't working. And that's why, so I would urge my colleagues to vote no on this, and then we'll move to the next level. So with that, Madam Administrator, can we have a vote on the amendment?
Senator Anwar?
Senator Anwar votes no.
Representative McCarthy-Vehy?
McCarthy-Vehy votes no.
Representative Belton?
Belton votes no.
Senator Marks?
Senator Marks votes no.
Senator McCory?
McCory's a no.
Senator, I did not see you on screen, please.
Oh, I'm sorry. Senator McCory's a no.
Thank you. Senator Summers?
Summers is a yes.
Representative Claudia Stecher,
Yes.
Representative Berger Givallo,
Berger Givallo, no.
Representative Biggins,
Biggins votes no.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes no.
Representative Elliott,
Representative Elliott votes no.
Representative Django,
No.
Representative Gilchrist,
Gilchrist votes no.
Senator Gordon,
Senator Gordon votes yes.
Senator Harkadel, Representative Cavers DeGraw,
Cavers DeGraw votes no.
Representative Kitt,
Representative Kitt votes no.
Representative Kennedy, Senator Kushner,
Senator Kushner votes no.
Senator, I did not see you on screen, please.
Oh, I'm here.
Thank you.
Senator Kushner votes no.
Representative Mara,
Mara votes yes.
Representative Martinez,
Representative Martinez votes no.
Representative Maureen Bello,
Representative Morin Bello votes no.
Representative Parker,
Representative Parker votes no.
Representative Paletta,
Paletta votes yes.
Representative Paletta, I did not see you on screen.
I'm here. Paletta votes yes.
Thank you. Senator Rahman,
Senator Rahman votes no.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Romano,
Romano votes yes.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Zopkis,
Yes.
ready when you are, Mr. Chair.
Representative, sorry, go ahead, Madam Administrator.
Total voting 29, those voting nay 20, those voting yea 9.
Okay. So the motion fails, and the amendment fails. We're back on the bill. I just wanted to quickly make a comment. I think Senator Summers had asked a question I didn't want to answer because there was an amendment on the floor. There is a provision clearly that the community has to be in approval of this. So there will be local control that would be decided by the people when it passes. Representative Zupkus.
Thank you, Mr. Chair, and it's amazing that that got the most votes than anything we voted on today here. I have a lot of questions on this bill, and I'm very disappointed about the amendment because this bill probably will get vetoed, I hope. And there are going to be some people out there that could really use this. And because that did not pass, I'm afraid that Representative Mara was right. But I have a couple of questions, and I have a lot, but I'm not going to ask them now. But one suggestion, first of all, is in the second line, it says where a person with a substance disorder substance use disorder may receive and all these things. I would make that a shall, because they should have all of these things. They should have access to those wraparound services. They should have access to educational information. My second thing is, could you please talk about the CON process? Because as I read this bill, I believe that these sites will not have to have a CON process, go through the process.
Sure. This amends the CON bill to exempt overdose prevention centers and harm reduction centers operating under pilot authority from the certificate of need requirements. This removes the regulatory barriers to pilot implementation while maintaining a broader CON framework.
So we have every other facility, organization, area, whatever you want to call it, has to go through a CON process. So why was this one carved out?
This is for the pilot project. Thank you.
Again, it's still carved out. So I do not believe that it should be carved out for the CON process. I think that should be in there since it is a healthcare, quote unquote, type of facility. So again, I have many, many questions, and we'll see where this bill goes, and I'll save that debate for another day, but thank you.
Thank you. Seeing no other questions or comments, Madam Administrator, can we have a roll call vote on the bill?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehi,
McCarthy Vehi votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory, Senator Summers,
No.
Representative Gladys Dietrich,
No.
Representative Burgos-Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
No.
Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Huckadell, Representative Cavers DeGraw, Representative.
Cavros DeGraw votes yes.
Thank you. Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner,
Senator Kushner votes yes.
Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Representative Paletta votes no.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Mr. Chair.
Madam Administrator, may I cast my vote at this time?
Yes, sir.
So Madam Minister, Representative D'Amico votes yes.
Thank you.
This is Senator Slapp. Can I vote yes as well, please?
Yes, sir.
Thank you.
This is Senator McCory. Can I vote yes also?
This is Senator Marks. May I vote yes also?
Thank you.
Did you
All
get
right.
Did you get Senator McCory?
Yes, sir.
Thank you.
Okay, moving on to the next item on the agenda. We'll because it's going to keep the votes open. So, all right. Next item is item number 6, Senate Bill 196. It's an act concerning hospital leaseback agreements and attestations concerning lack of private equity control of the hospital and control of or interference with the professional judgment and clinical decisions of certain healthcare providers. This is a JFS language with LCO 2384. Do we have a motion?
So moved.
Moved by Representative Kristen McCarthy Vahey. Do we have a second? Second is Representative Belton. And with that, this is actually the bill that this committee had moved out and passed from our committee. The rationale for this is that it's no secret private equity has caused harm in our state with at least the 3 hospitals that we had seen that were impacted by California-based private equity. If you look at this bill on its own, it's going to be addressing part of the concerns, but if I want people to keep in mind that this conversation about private equity will continue on around public health for a number of bills. There's a governor's bill on CON, and there's a previous bill from the governor and the attorney general, and this time Senator Looney and Attorney General have moved as well, that we will be hearing soon. I think they have a public hearing on that topic coming up. So there'll be 2 or 3 bills that we will have that we'll put together, and we'll come up with a strategy to be able to look at combined one single bill, hopefully. But this bill is a work in progress because of the other bills that have perhaps some different ideas. Some of them are better. Some we will have to have some more conversations around. And that's the rationale I want you to be aware of. So with that, I'm sure people have some questions or comments, and I will see Senator Gordon's hand is raised. Senator Gordon, please go ahead.
Thank you, Mr. Chairman. I think people have known my position about private equity being involved in any way with hospitals in Connecticut, and I'm a firm believer we should just be banning them 100% and have one sentence that just says that, and that's an easy bill based upon the evidence and the facts that we've encountered in Connecticut and other states have encountered, especially the worst situation in the Commonwealth of Massachusetts to the north of us. I have one question and then one comment, Mr. Chairman. Is it my understanding that in the JFS language in section or subsection 1B that the date of October 1st, 2026 gets moved out to February 1st, 2027 with regards to not allowing these sale leaseback transactions that are part of the overall problem that has hurt the hospitals in Connecticut that were owned by Prospect?
You're talking about October 1st, 2026?
Yes, and did that get moved to February 1st, 2027 in subsection 1B? I just want to make certain I'm reading the different versions correctly.
Correct. You're correct.
And my quick follow-up then on that is, why was it moved out? Does this in any way then allow hospitals until February 1st that might be currently looking to do this to now give them an avenue to do it, whereas they might not have if this went into effect October 1st of this year?
My co-chair wants to make a comment, and then I'll make a comment right away.
Thank you. Just want to clarify the date issue. The change to the date was for the hospital attestation portion, just to clarify that. Thank you, Mr. Chair.
No, I appreciate it. That's why I was asking the question. I just wanted to make certain if it was about the attestation versus in subsection 1B when the sale leaseback transactions would be prohibited. So the October 1st, 2026 provision prohibiting these types of transactions still is in JFS?
Correct.
And I also want to say that subsection 1C, which would give a terrible loophole to hospitals in financial distress to still enter into these really bad real estate transactions. I'm glad to see, if I've read the JFS correctly, has been removed, because if a hospital's already that bad in distress, why would you want to make a deal with the devil and just make things worse? And that's my opinion about it. But I'm glad to see the bill was improved in that way, and I think the bill does need some further work, but it is the JFS is a good step in the right direction, and I appreciate that. Thank you, Mr. Chairman.
Thank you for your comments. Seeing no other comments, Madam Administrator, can we have a roll call vote on this? Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory.
Senator McCory votes yes.
I did not see you on screen, sir.
Senator McCory votes yes.
Thank you. Senator Summers. Representative Gladys Dieter.
Yes.
Representative Berger Givallo. Representative Biggins.
Biggins votes yes.
Representative Carpino.
Carpino votes yes.
Representative Dauphiné. Representative D'Amico. Representative Elliott. Representative Django.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Senator Hockedal. Representative Cavers de Graw. Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy. Senator Kushner. Representative Mara.
Mara votes yes.
Representative Martinez.
Martinez votes yes.
Representative Maureen Bello. Representative Parker. Representative Paletto.
Paletta votes yes.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Romano.
Romano votes yes.
Senator Slabb. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator.
Madam Administrator, this is Senator Kushner. May I vote yes?
Thank you.
This is Representative Morin Bello. May I also vote yes?
Thank you.
Madam Administrator, Representative D'Amico votes yes.
Thank you.
We'll keep the votes open later, so we'll let you know. But thank you, Representative D'Amico and everyone else. We move to the next item on our agenda. Item number 7, Senate Bill 238, an act concerning emergency medical services response time transparency. Proposed action is a JFS. It's an LCO 2382. Do we have a motion? Representative Kristen McCarthy Vehy moves. Is there a second? Second by Representative Jenga. And with that, I'll give you a little bit of a background of this. The state of Connecticut and other states all have a way of keeping track of the response times. And this bill is looking at the keeping track of the response times, but being able to share it in a timely fashion. So the report that we have, from what I understand, for the state of... Oh, sorry, yes. Just wait for 1 second. Can the guys on Zoom hear us? They can.
Yes.
Yes, we can.
Yes, we can.
Okay. Good. Thank you. Can the people on YouTube hear us? I want to make sure. Just bear with us for a second. Madam Administrator, can we check if the people on YouTube can hear us? Everybody on YouTube, anywhere. They can. Okay, good. All right, back on track. So just so that everybody is aware, number 7, Senate Bill 238, JFS 2382 has been moved by Representative Kristen McCarthy Vehy, seconded by Representative Jenga. And I was just giving you a background on the emergency medical services response time transparency. This bill is having a timely information about the response time. It's no secret that parts of our state, especially the rural parts of our state, the response time is changing. The EMS service is going through struggle. Many of the EMS systems, the ambulance services have shared their concerns about this, and we do anticipate some federal funding coming to our state. It's important to have a better understanding of the current status of the timelines, and many other states have a dashboard that gives a pretty timely insight into the response times, which allows us to understand the disease process, but also our response time. So this is going to have us do this. The JFS language is changing it to a monthly base, just which would make everybody's workload a little less, but a little more than doing it once every 1 or 2 years. So we want to try to make sure that we have it on a monthly basis. So with that, Representative Clarice Dieter has a question or a comment.
Thank you, Mr. Chair. What was the reason from changing it from quarterly to monthly?
The reason is the workload that it would create, and then we would still be able to get the data that would allow us to know the patterns, and then hopefully make investments and see how we can help out our citizens in various parts.
And will they be able to accommodate the change to monthly, doing it every month now?
We are hoping that it will be less. Again, we're going to have to require that, and we'll probably have, once we pass this bill, we'll have more data and more conversations on this. Sure. Can we take Senator Gordon first, and then Senator Gordon?
Thank you, Mr. Chairman. And I do have that concern. If going from quarterly to monthly is asking too much, given the workload that a lot of EMS does, especially if we're asking EMS in small towns or towns that may have voluntary fire EMS departments, where they're struggling already with time commitments, financial commitments, recruitment commitments, retention commitments. Has this proposed change from quarterly to monthly been discussed with EMS services to see if this is something doable for them versus finding it out later? That's my concern and question, Mr. Chairman.
Sure. The data that we have is not recent. The data that we have access to is from 2024. And if we want to make investments in the next year or so, we will need to have more current data and know what's going on. I know that EMS services do provide the data on a regular basis to the DPH, and there's a way to try and get that information in an effective manner to have better decision making. So right now, did we have a conversation with everybody in the EMS? No, we did not.
Thank you, Mr. Chairman. I think no matter how I vote on this, I'll flag it that before we move from quarterly to monthly, we want to certainly find that out to see if it's doable on their part with everything else they have to do. Thank you.
Thank you. Representative Carpino.
Thank you, Senator. My concerns were flagged by Senator Gordon as well. I'm going to be a no today, not because I don't believe in transparency and folks understanding exactly the response time of their emergency services, but I do think it is a significant enough change with the sudden JFS that I want to talk to my two communities, having two small communities, small but mighty, and I have the utmost respect for my EMS providers. I do think it is only fair that I talk to them, particularly with one being a volunteer department that utilizes outside services for some of their support of the town. I think it would be unfair for me to support this without talking to them. So my no today is not because I don't believe in additional transparency, because I think I owe it to my community to talk to them before I support this, sir. Thank you.
Thank you. With that, Madam Administrator, can we have a roll call vote, please?
Senator Anwar?
Senator Anwar votes yes.
Representative McCarthy-Vehy?
McCarthy-Vehy votes yes.
Representative Belton?
Belton votes yes.
Senator Marks?
Marks votes yes.
Senator McCrory?
McCrory votes yes.
I did not see you on screen, sir.
Senator McCrory votes yes.
Thank you. Senator Summers?
Summers votes yes.
I did not see you on screen, please.
I'm here. Summers votes yes.
Thank you. Representative Clara Destetria.
Claire Destetria votes yes.
Representative Berger Givallo. Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné. Representative D'Amico. Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes no.
Senator Hackadell. Representative Cavers de Graaf. Representative Kitt.
Representative Kidd votes yes.
Representative Kennedy. Senator Kushner.
Senator Kushner votes yes.
Representative Mara.
Mara votes yes.
Representative Morin Bello.
Representative Morin Bello votes yes.
Representative Martinez.
Martinez votes yes.
Representative Parker. Representative Paletta.
Paletta votes no.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes no.
Representative Romano.
Romano votes no.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Mr. Chair.
Thank you, Madam Administrator. That brings us to the next item, which is number 8, Senate Bill 239, an act concerning nutrition and food-based interventions for patients with diabetes and congestive heart failure. This is JFS language, LCO 2385. Do we have a motion?
So moved.
Moved by Representative Kristen McCarthy-Vahey. Do we have a second? Representative Belton, thank you for your second. And again, this concept has been something that we have touched on in this building. I wanted to thank Representative Foster for her work on this area, but also the various conversations in various committees that we have had about this topic. This is an effort to make sure that the hospitals that are required to have community health needs assessment to examine the nutrition needs of the community members with diabetes and congestive heart failure. These two illnesses, when ideally, if we had a magic wand, we want everybody to get healthy nutrition so that they remain healthy and well. But when we have limited resources, we have to identify the areas where it would have the biggest impact, and that's why diabetes and congestive heart failure was identified. Actually, if food is used as medicine in these situations, you can reduce hospitalizations, reduce long-term complications, and this bill just helps us move in the right direction for that reason. With that, I see Senator Summers has a question. Senator Summers.
Yes, thank you. I was hoping that you could explain to the committee some of the language changes that we made during our leadership meeting, because I see that the Connecticut Hospital Association and Children's Medical were opposed to this originally. Have they seen sort of the watered down language a little bit concerning how to prioritize people with diabetes and congestive heart failure as far as the nutrition is concerned?
Thank you. It has moved to a permissive language rather than a requirement, to your point, Senator Summers. So this gives them, listening to their concerns, we have made this not a requirement. Thank you.
Thank you. I think that's important. Thank you.
Thank you. Representative Mara.
Thank you so much, Mr. Chair. I'm not necessarily against this, but I mean, I kind of, as I do with lots of things, I kind of like to step back and look at the holistic picture of, we picked diabetes and CHF here, but there's lots of other diseases that could require, autoimmune diseases, kidney diseases. Why are we just focusing on these two when I could argue that others maybe could even, there's a whole host of gastrointestinal diseases, Crohn's disease, all these diseases that could require special diets, and yet we're just focusing on two. I don't like to kind of, well, this is like picking winners and losers of diseases in this case, but when we think of healthcare, I like to think of it very holistically, and this does not seem to be there with that.
Thank you for that comment, and you're right. We want, with a magic wand, which we do not have, we want every illness to be covered. These two have been shown that the return on investment is the highest for benefits. The number of rehospitalizations, readmissions to the emergency room, and then are much less if there is a nutritional management for both diabetes and congestive heart failure. So it's not taking away from any other source. Ideally, if the Medicaid was not in the current status from some of the federal laws, we would be looking at this because those studies have been done and that's been part of the strategy in Medicaid side. But I think we have lost about 4 or 5 years of Medicaid work because of the current federal policies. So we're trying to see what we can do with the limited resources that we have, and that's why we are looking at 2 illnesses. Otherwise, the hospitals who are already feeling insecure would feel far more insecure if we added many other illnesses in the picture. Thank you.
Thank you so much, Mr. Chair. You're speaking my language. Bang for the buck makes a lot of sense. I'll support this.
Thank you. Seeing no other questions or comments, Madam Administrator, can we have a roll call vote?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCrory,
Senator McCrory votes yes.
Senator Summers.
Yes.
I did not see you on screen, please.
I don't know why I'm on screen solid. Yes.
Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Berger Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino, Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Harkadel, Representative Cavers de Groot, Representative Kitt,
Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Maurer,
Mara votes yes.
Representative Martinez,
Martinez votes yes.
Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Paletta votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Romano.
Romano is a yes.
I did not see you on screen, please.
I'm on. Can you see me now? Thank
Yes,
you.
ma'am. Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator.
Madam Administrator, this is Senator Kushner. May I register my vote yes?
Thank you.
Thank you.
Next item on the agenda is item number 9, House Bill 5164, an act concerning use of funds in the Tobacco Settlement Fund. We have a JFS language, LCO 2386. Do we have a motion?
So moved.
All right. See, we have so many good people here already. So Representative Christine McCarthy-Vahey has moved and seconded by Representative Clarice Detrier. This is our annual bill. We want to make sure that we follow the recommendations of how much of the Tobacco Settlement Fund should be used for prevention of tobacco-related illnesses and prevention of usage. We are allocating $32 million as a request, and there was a drafting error. That is the LCO change. And with that, Representative Claire Teacher.
I'd like to add this item to the consent calendar.
So moved. All right. Second, move on to the next item is item number 10, House Bill 5165. It's an act requiring the evaluation of the appointment of a receiver to manage hospitals in financial distress or operational crisis. This is JF language. Do we have a motion? So moved. Second. All right. Same, moved by Representative Kristen McCarthy-Way and seconded by Representative Claire Teacher. As the bill says, this is creating a way to have a receivership program if there's a financial distress or operational crisis of a hospital. Representative Claire Teacher.
I'd like to add this item to the consent calendar.
And it is added to the consent calendar, seeing no concerns. Moving on to the next item on the agenda, item number 11, House Bill 5166, an act concerning social work licensure. It is JF to the floor. Do we have a motion? So moved. Moved by Representative Kristen McCarthy-Vehy and seconded by two people at the same time, Representative Claire Teacher and also Representative Kai Belton. And going once, no. And with that, Representative Kristen McCarthy-Vehy, do you want to speak about this?
Thank you very much, Mr. Chair. Thank you to those who brought this issue before us. We heard from the National Association of Social Workers, from the dean of the UConn School of Education, from the Alliance, all of them asking that we will allow our LMSWs, our licensed Master Social Work students who have gone through a graduate education program from an accredited university and have participated in practicums, to not take the master's level exam, similar to our associate level for the marriage and family therapists who are not required to take an exam. And this bill would actually remove that requirement for them to do so. This is a JF. You may recall that we did sunset this exam requirement, and that ended January 1st. So we do have a conversation that we'll need to have related to those students, if we do decide to go forward with this, related to the students who are graduating between January and the effective date of this. So I'm happy to take any questions. Senator Summers, to be followed by Rep. Mara.
Thank you. I was wondering, Madam Chair, if you could explain why the Association of Social Work Boards is opposing this bill. I think that's important to have on the record. Thank you.
Thank you very much, Senator Summers. I think there are a variety of reasons, and certainly as the body who administers that test, I understand why they would believe that this is an important tool. I think that that's where we are hearing from a number of social workers in the state who have taken that test and are hearing, I think, in concert with the board. I think it's important to balance that with the fact that we're hearing from providers who have been employing social workers who have not taken this test that they are not seeing any harm or detrimental effect. And in fact, they want to be sure that we are able to have a diverse and plentiful workforce, that is the really presenting issue, which is what this bill will help us to address. Representative Mara.
I appreciate your answer. I think it's important. Sorry. I just wanted to say I appreciate your answer, and I appreciate that because if people are looking, they might very much wonder why, and that makes perfect sense. I just wanted to make sure that you could state that for the record. Thank you, Madam Chair.
Thank you, Senator Summers. My apology, you did still have the floor, and I appreciate the question and the chance to discuss that on the record. Now, Representative Mara.
Thank you so much, Madam Chair. I think I was a little confused as to which test this was that we were going to be excluding. I thought this was the test before they went through their practicum, but this is after the practicum. Is that correct?
Thank you for the clarifying question. So when you are a student in a Master's of Social Work program, you participate in a practicum as part of your graduation requirements. There is a separate exam and a separate category of licensure, which is the licensed clinical social worker, which is different than this. This is the licensed master social worker. So again, similar to the associate level for the marriage and family therapists, who are those new practitioners just graduating. That's the parallel with the LMSW. The LCSW, which we are not changing the test requirement for, that's the clinical social worker requirement, requires that post-graduation you are receiving supervision and you have a number of practice hours. I believe it's 3,000. Yes, thank you. Rep. Belton is confirming. And we are not changing that test requirement.
Okay, and then just one more question, please. My understanding is that the reason why we'd be getting rid of the test is because it's biased. However, my understanding is that the test was revised and we don't yet have data back on whether it is still biased or not. Is that correct?
So I will admit that I don't know exactly where the status of the revisions are. We don't have the data. And you're right that the reason for removal and the request and the testimony and what we've heard is that there is such a disproportionate difference in those passage rates. And that is for various groups related on disability, race, and also age for students who are students like me who might be going back to school as an older student. So that was the reason, you're right, for originally putting a pause on the test. And at this point, what we're hearing from, again, the National Association of Social Workers and our educators and higher education leaders, our dean, is that they don't feel that we have sufficient evidence that the issue has been addressed.
Even though they haven't seen the data?
That's my understanding.
Okay, thank you, I appreciate that.
Rep. Claridis Teacher.
Thank you, Madam Chair. Can you just please, once again, for everybody out in TV land, since we suspended this exam, what of the providers, what's their feedback on that?
The providers are coming to us saying, please keep this exam out of the mix. Please pass this bill. And that is in part because of an issue that we have addressed here and understand, which is workforce recruitment and retention. So the providers, the Alliance and our individual providers have told us that they would like us to pass this bill.
Thank you for that, Madam Chair.
Thank you. With that, back to you, Senator Elmore.
Thank you. Seeing no other questions or comments, Madam Administrator, can we have a roll call vote?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
How they use chaos to get strong.
Senator Marks votes yes.
Jewish wealth and real estate secrets.
Senator
Comment
McCory,
money.
Senator McCory votes yes.
thank you. Senator Summers,
Senator Summers votes yes.
Representative Claridis Teacher,
Claridis Teacher votes yes.
Representative Berger Givallo, Representative Biggins, Representative Carpino,
No.
Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Jenga,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Harkadel, Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner,
Senator Kushner votes yes.
Representative Morrow,
Mara votes no.
Representative Martinez,
Martinez votes yes.
Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletta,
Votes no.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis? Thank you, Mr. Chair.
Thank you, Madam Administrator. We move to the next item on the agenda, which is item number 12, House Bill number 5167, an act concerning the disclosure of water quality test results for certain private and semi-public wells. Proposed action is JF to the floor. Do we have a motion?
So moved.
Moved by Representative Kristen McCarthy-Vehy and seconded by Representative Clarice Teacher. And this is a bill that comes to us. It's a bipartisan bill, simple bill, which is relevant for many communities, should be relevant for all communities, where this bill permits a local health authorities and the Department of Public Health to disclose private and semi-public well water quality test results to certain individuals without requiring the Commissioner of Public Health's prior approval. It clarifies who may receive those results, including the property owners, adjacent property owners, and contract purchasers. And this adjusts effective October 1st, 2026. Representative Clarice Teacher.
I'd like to add this item to the consent calendar.
And seeing no concern, we have one question, but Senator Gordon, do you have concerns about this being on consent calendar? We'll add it, but you can continue the conversation.
No, I have no concerns about being on consent calendar. I just want to say thank you for the chairs for moving this bill forward.
Thank you. And I know your district and part of my district and a lot of our colleagues' district, Representative Nuccio, as well as Representative Foster, they've all been very vocal to try and help the community out. So we hopefully will move this forward. Next item on the agenda is item number 13, House Bill 5168. It's an act concerning secure transmission of minor patient safety plans to school by healthcare providers. And this is JFS with LCO 2381. Do we have a motion?
So moved.
Moved by Representative Kristen McCarthy-Vehy. And do we have a second? Second by Representative Belton. I can give you a little bit of a background. This is an important bill that comes to us through Representative Biggins, and we wanted to thank him for his advocacy on this. This was a bill that we had discussed last session. It was 7158 at this time. Today it's 5168. This basically is an important concept to create a safety net for our youth who have had challenges in inpatient behavioral health unit, and with appropriate safety, with HIPAA safety, with secure communication system, identified school personnel would be informed so that there is a process and a safety plan within the school system as well. This is part of the continuum of care and helping take care of the youth and especially when they're in the vulnerable phases. So this bill is an important bill. I would encourage my colleagues to support this. I see Senator Summers has a question or a comment. Senator Summers.
Yes, good afternoon. I've heard from many of my school administrators that are not in support of this particular bill, and I'm just trying to understand exactly why. And when I look at the notes here, it looks like there's many folks that are against this bill that should have a stake in it. So I'm just wondering if you could speak to that before we go ahead and pass this bill today.
Could you clarify a little bit what concerns they bring to you?
That's what I'm trying to, it looks as though the Connecticut Federation of School Administrators, the CT Children's Associations of Board of Education are all against this bill or have written testimony opposing this bill. I have not gotten a clear answer other than they are concerned about liability. They are concerned about adding an additional work, and they say this is already can be done, that we don't need this bill. So I was wondering if anybody else had any additional information on that. I'm going to be a no today to flag this bill because of that. But if anyone in particular, the chairs had any additional information, I would love to have that be read into the record today.
Sure. I think CAPS is supporting the bill, and I think CABE is also supportive of the bill. and so we feel many of them are. But I can share with you that this is creating new systems, and that's part of the concerns people may have. And then the idea is that within the school, individuals would have to enroll into secure messaging platforms. And again, the health information exchange will be involved in the process as well. We are going to make sure that it's confidential, and only the designated school staff, which may be supervisors or a school nurse, would have the assignment to be able to get that secure messaging. Key thing is that there are children with significant mental health or behavioral health issues who have been sick enough to be in a inpatient setting or close monitoring, and when they go back to school, the school staff need to know within the HIPAA regulations that this individual needs care and needs help, and then make sure that they are protected, and if there are any concerns that come up, there would be appropriate responses to help out in coordination with their clinician and the family if possible. So I think
Yeah, I'm going to be a no today because I think there's conflicting viewpoints that I haven't gotten to the bottom of exactly what the critical issue is. So you have hospitals, supporting it, and the Association of Public School Superintendents supporting it. But on the other hand, you have the Federation of School Administrators, Connecticut Children's, and the Association of Boards of Education opposed to it. So until I can feel comfortable that everyone's on the same page, I'm going to be a no to flag this today. So I just wanted to state that in for the record. Thank you.
Thank you. Representative Kristen McCarthy-Vahey.
Thank you very much. And I would also just like to echo my thanks to Representative Biggins, who has been working with the stakeholders, has been talking regularly with the Connecticut Hospital Association and our State Department of Education. I think that I would also flag that, or point out that the S language addresses the change that the Connecticut Association of Boards of Education had discussed in their testimony related to professional development, and that is now changed to guidance language. So that is one of the issues that was addressed. So I know that there remain questions. I also would like to say that we wish a happy birthday to Rep. Biggins' daughter, and that's where he is, I believe, right now. I know he would be happy to answer any questions that members have as well. But I do think that this bill, the slight change from last year is just that guidance versus professional development. Thank you, Mr. Chair.
Representative Zupkus.
Thank you, Mr. Chair. Mr. Chair, I will be a no today to flag it, being the ranking member on education. There are quite a few people that I would like to speak to in regards to this. I know in talking about it in the past, being a mandate aspect and all of these things. So for today, I am a no, and I will be following up with all of the education folks. Thank you.
Thank you. Representative Claridis Teacher.
Thank you, Mr. Chair. And I know Rep. Biggins has done a lot of behind-the-scenes work on this bill. Did we rectify what happens to the, I almost said athlete, to the student that either graduates, moves up, or moves out of maybe the town or state with their records?
In our previous conversation, that the records would, I think, let me rephrase if I understand. You want to make sure that the records are not within the school system after the person.
Either they're destroyed or they follow the person. So whatever. I mean, I assume that the student would have the question, I'm going from grammar school to middle school. I want those records to go with me, or do they have to start the process over again?
Representative Kristen McCarthy-Vahey.
Thank you, and I'll want to make sure that I'm understanding the question correctly, but what I will preface my clarifying question with is that these are required to be HIPAA compliant, and the way that this conversation has been set up and worked on with those stakeholders who Rep. Biggins has been negotiating with is to assure that that information remains confidential and HIPAA compliant. There are two parts to your question, I think. One is, what happens if you move, say, to another state, which would be similar to any other medical record situation that would be a part of that student's record. So I don't know the answer to that, but the idea is that it is a parallel process. Your question with respect to moving from an elementary school, say, to a high school, one of the things that the bill actually speaks about is that there is a designated person. So there is choice on the end of the education environment. So it would depend on assuring that, say, if that district or school has set up their designated person. I will say if you're moving between districts, that could change. All that said, safety planning is something that is set up for the aftermath of a clinical event and may not be in place. If you move, say there was something that occurred and you were hospitalized and had an issue with needing a safety plan as a 7th grader, that may not apply in 9th grade. So I know I don't have a specific answer to your question, and I'm sure Rep. Biggins is going to have an even better one for you, but I think the most important part is that the HIPAA compliance is there. Thank you, Mr. Chair.
Thank you. Seeing no other questions or comments, Madam Administrator, can we have a roll call vote, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory,
Senator McCory votes yes.
Senator Summers,
Summers votes no.
Representative Clarice Detrier,
Yes.
Representative Burgess-Givallo, Representative Biggins, Representative Carpino, Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Representative Django,
Yes.
Senator Harkadel, Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Kitt votes yes.
Representative Kennedy, Senator Kushner,
Senator Kushner votes yes.
Representative Morrow, Representative Martinez,
Representative Martinez votes yes.
Representative Morin-Bello,
Representative Morin-Bello votes yes.
Representative Parker, Representative Paletta,
Paletta votes yes.
Senator Harlan, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Thank you. Thank you, Mr. Chair.
Thank you. That moves us to the next item on our agenda. Item number 14, House Bill 5169, an act requiring and establishing an alert in the statewide health information exchange regarding patients with a history of violence or combative behavior towards a healthcare provider. JF to the floor, Representative. So move. Happy to move.
Happy to second, actually. If you want to move, I'll withdraw my.
Okay, moved by Representative Martinez. Is there a second?
Seconded.
Seconded by Representative Kristen McCarthy-Vahey. This is a continuation of the important work that this committee and this legislative body has done to make sure our healthcare workers are protected. I can tell you that this will identify and flag an individual who would be considered unsafe for a clinician or a healthcare worker providing the care, and this would allow them to still receive the care. This bill is in no way going to restrict care to anybody. It is just making sure that the individuals providing that care are protected. That's the critical part in this bill that is important, and this would have the information available to others providing the care. This is not the final product. There's a lot of conversation happening to address some of the concerns, but we want to move this bill forward, but also recognize publicly that there's work that's going on, and Representative Martinez is working on this. So Representative Martinez, you want to add a few thoughts on this?
Yes, this bill is really important for healthcare worker safety. Right now, if you look at different areas of healthcare, such as home care, we're able to look at the judicial records and look back 10 years and know if there's been an assault, excuse me, with a healthcare worker, if somebody's been convicted within the last 10 years. But we're not always aware of what's going on if a patient were to strike a nurse in a hospital, long-term care setting, or another setting. We're not made aware of that information. And what is happening is a lot of healthcare systems already have a banner or a warning in place for their computer systems. Say, for example, if you were at Hartford Hospital, you would know if something was happening in any of Hartford Healthcare's computer system. But then you went over to Bristol Hospital wouldn't know because they're not part of the same computer system. So what this does is this would take that information and put it into the health information exchange and would be able to flag when the patient goes to a new facility that wouldn't have the information in for the admitting department. So they would be able to see that information to keep that continuum of information going so that all healthcare providers are aware of the risk and can help plan accordingly for the patient and the healthcare worker's safety.
Thank you for that. And I know some of the other colleagues have questions or comments. With that, I'm going to ask Representative Claritis Dietrich, followed by Senator Summers and Senator Gordon.
Thank you, Mr. Chair. Excuse me. My question in this, will this be a flag in the system, or would it also give people the opportunity to put notes in? So there's some context as to why this person is being flagged.
Representative Martinez.
So I have spoken with some people over at Connie, and I've seen examples of some of the current safety flags that are in the Connie system, such as a major medical event. So if a patient codes at the hospital, for that it would say major medical event, the date and the diagnosis. The information that's in the healthcare information exchange is different than what every provider is seeing. This is information that the people that with Connie access would be able to see that information. So it is still being discussed exactly how that safety flag, what that would look like, but the point would be to ensure a healthcare worker would know if there was an assault on another healthcare worker.
Okay, thank you. And I think we all want to make sure that whatever's flagged in there, it's the appropriate information. So if the person has, I'm going to make something, has a fear of the color red and that makes them get violent, you're going to go in there that day without red on. You want to be able to have those things. So it's not, you know, a true violent behavior person. It's just whatever the triggers are. We want to make sure that they have the ability to put the full explanation in their notes, so then the healthcare provider is able to go in safely. And to follow up with that, once they see that there's a flag in the system, do they have the ability to say, I don't want to see that patient?
So in general, we would make provisions to make sure that it's the safest possibility. So there wouldn't be anything in this that would prevent care, but say in a home care setting, maybe this would set the flag that, you know, we should have 2 people go in, we should have an escort. Maybe this patient gets aggravated with male providers or female providers, so we can make those accommodations to make sure that the patient is safe and that the healthcare worker is safe.
Okay, thank you so much for your explanation. Thank you, Mr. Chair.
Thank you. Senator Summers.
Yes, thank you. I understand the reason that we want to help, make sure that nurses are safe. But I am concerned on some of the language. I'm concerned that we have so many medical providers against this bill. I'm concerned that I don't necessarily trust the Connie system. I would like to know what happens if someone opts out of the Connie system and the health information exchange. How do you flag somebody if they have opted out of that? I do believe we can opt out if you tell your provider you want to opt out. And I would also like a clear definition of what is combative behavior. Somebody could believe that combative behavior is not risen to violence, but strongly disagreeing or being verbally non-compliant, et cetera, or unsafe, and who has access to all this information. I think there's a balance between protecting our healthcare providers, which I think is important, but also protecting the patient's, autonomy, their dignity, and their privacy. And when I see that the Hospital Association, the Medical Society, Mental Health CT, Legal Rights Project are all against this bill, it gives me great pause. I understand also DPH and DEMIS, the Commissioner on Racial Equity and in Public Health, are also opposed to this bill. That gives me great pause. I understand it sounds like it's a work in process, but could the proponent of the bill be more specific on some of the questions that I've just asked? Thank you.
Sure. Representative Martinez, do you want to answer some of these?
Absolutely, and those are excellent questions. I have already been having conversations and will continue to have conversations. As far as the equity piece, one of something that was pointed out to me that I absolutely agree on is combative is not the best objective word. I think violent behavior. We are still having that conversation, but I do think that combative may lead to some subjective information. And the point is to make sure that this is very objective, just like a vital sign is a temperature is 98.2. This is what happens objectively. As far as the Connie system being able to opt out, yes, you are correct. And actually, I was just going through that. So I am looking forward to continuing conversation to see whether or not we would put something that says patient may opt out or how we can move forward. The idea being to get as much information to healthcare providers as possible, because right now we have providers that are going into homes alone that have no idea that a patient may have hit a healthcare provider in 4 different ERs in the last 2 years. And that's information that, if they had known, they can prepare for those safety aspects. And, so if we can do things to make the environment safer for our healthcare workers and for our patients to deliver care, I think that we should do everything that we can. So I'm actively working on this and will continue to do so.
Thank you. Senator Summers?
Yes, I appreciate that response. So it sounds like this is definitely still a work in process. The idea, and I appreciate your response on combative, because we all have a different definition of combative. Sometimes, even just in this legislature, when we disagree on bills, it could be considered combative. But so I'm glad that we are going to try to refine that language. And I appreciate all the work that you're doing. I do think it's important to keep our healthcare providers safe. But like I said, because there seems to be a significant amount of opposition from, in particular, the Med Society and, the Mental Health and Legal Rights Project, I'm going to be a no today to flag it. And I hope that we can get them on board so I can support this, which I think is an important piece of legislation if it comes to the floor. Thank you.
Thank you, Senator Gordon, followed by Representative Reddington Hughes. Senator.
Thank you, Mr. Chairman, and I appreciate the intent behind it. I've taken care in my many years as a doctor patients who have various degrees of being combative, some of whom, for example, elder patients due to dementia who could be viewed as being combative, but they really aren't. They're actually more of a harm to themselves of hurting themselves, and they may not even know what they're doing, versus hitting somebody. So it can be very subjective. I have a lot of concerns, and I share the concerns raised in testimony. This is a huge topic, and I understand we want to do more to help healthcare professionals in different scenarios and in different settings. But given the many moving parts of this and also very serious concerns, number one, how exactly will this be documented in the HIE? Number two, Connie is a bad HIE to begin with, and I don't support Connie given its track record, and there's a lot of concerns with it. And number three, I don't think this should be a work in progress coming out of committee. We should really be spending our time making certain we sort through all of this, and it may not be able to be done given the short calendar we have this session with the Public Health Committee. So I will be voting no to flag a number of serious real-world concerns about how this would be made operational. And I'll also make a comment that if a patient is truly combative, for example, hits a nurse or is purposely throws something at a secretary in the hospital office, those things get flagged, and they get flagged in the record certain appropriate ways. So there wouldn't have to be a separate flag put into Connie for it. It would be in the record. So again, I understand the intent. I think it's a well-meaning intent. But as we know, the devil's in the details, and there are so many concerning and unknown operational details that have to be sorted through. I have to vote no for those reasons. Thank you, Mr. Chairman.
Thank you so much. Representative Reddington Hughes.
My question has to do with, in the event, due to cultural differences, the inability to perhaps understand, and then also, in some cases, drug interactions that may not really give the best result and may wind up having somebody become agitated. For those patients, in the event that they are flagged in those instances, are they actually are they notified that their records are now flagged?
Thank you for your question, Representative Reddington Hughes. Representative Martinez.
So I do want to circle back on both comments that we just heard. I want to make very clear that this bill isn't about intent, it's about safety measures. So it's not saying that a patient chose to and wanted to be violent with a healthcare worker. No matter the circumstance, it's objectively looking at it. You can have a patient that, for instance, Sunsdowns, right? It doesn't mean that they're meaning to be violent towards a healthcare worker, but it's giving us that information so that we can properly prepare. So this is in no way saying, that this person just wanted to, without any reason, hit a nurse. So I want to be really clear about that. Like I said, we are still going through clarifying things, but we would make it so that Connie would be reporting this information as it is with other flags, and I would believe that the same rules would apply for about patients knowing. I will tell you, as was said earlier, it is documented. No matter where a patient is, if a patient's hitting a staff member, it is being documented. The problem is that it's not being shared facility through facility. So I just would not have any idea what's happening at some hospitals when I'm going into a patient's home, and that's what we're trying to avoid, or a nurse walking into a long-term care room or one hospital versus another. So this documentation is happening. The point of this bill is to make sure that all providers are aware.
So if I'm understanding correctly, then if there was an incident in a hospital that was as a result of a drug interaction, it was not a mental illness, it was not an intentional thing, then that would be something that was flagged in the Connie system.
I think there's definitely room for discussion on patient diagnosis and pertinent information such as that, for sure. And I also, healthcare workers do understand, though. I know if I see a patient with a flag, it could be for a variety of reasons. It doesn't mean that they're always violent, but it's going to be able to help me better prepare. A lot of our patients with mental illness are not, they're not meaning, right, to be violent. There's lots of reasons and circumstance. I think just having objective information so that we can prepare helps keep everybody safe.
Thank you.
Thank you. And seeing no other questions or comments, we will have Madam Administrator do the roll call for us.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory,
Senator McCory votes yes.
Senator Summers.
Summers votes no.
I did not see you on screen, Senator.
Summers votes no.
Thank you. Representative Clara Desdichar,
No.
Representative Burgos-Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino, Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Jengo,
Representative Jenga votes yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Harkadel, Representative Kitt,
Representative Kitt votes yes.
Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy, Senator Kushner,
Senator Kushner votes yes.
Representative Morrow, Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Representative Morin-Bello votes yes.
Representative Parker, Representative Poletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano.
Romano votes no.
I did not see you on screen, please.
I'm here on screen.
Thank you.
Yep.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator. That moves us to the next item on our agenda, which is item number 15, House Bill 5239, an act concerning the Department of Developmental Services recommendations regarding the Independent Mortality Review Board and Fatality Review Board. This is a JFS language, LCO 2448. Do we have a motion?
So moved.
Okay, moved by Representative McCarthy-Vehy and seconded by Representative Claire Desdichar. This is comes to us from DDS. It's a important bill, which is just cleaning up some things from an executive order by Governor Malloy in the past, and just streamlining the process and codifying that the mortality review requirements would be sent to Independent Mortality Review Board within the DDS. And the commissioner's duty is to conduct a comprehensive, timely review when a person with intellectual disability dies, while DDS has direct or oversight responsibility. And this is an important bill. And Representative Claire Desdichar.
I'd like to add this item to the consent calendar.
And it is added as we see no concerns from anyone. Moving on to the next item on the agenda, item number 16, House Bill number 5240, an act concerning the Department of Developmental Services recommendations regarding various revision to developmental services statutes. This is also a JF to the floor. Madam, sorry, do we have a motion? Seconded, moved by Representative Kristen McCarthy-Vahey, seconded by Representative Claire Desteacher. This one is, again, a bill coming to us from DDS with the recommendations. This is about the targeted statutory revisions recommended by DDS affecting DDS housing subsidies for individuals with intellectual disabilities in certain supervised housing. The DDS Community Residential Facility Revolving Loan Fund Mortgage Loan Program. It updates and streamlines the definition, removes obsolete loan purposes, and adjusts allowable loan uses and caps, and clarifies documentation and capital loan agreement, and updates the bond proceeds purpose section. This is an important bill. Representative Claire Desteacher.
I'd like to add this item to the consent calendar.
And seeing no concerns, so move to the consent calendar. With that, we now are on the consent calendar. Okay, Madam Administrator, can we have a roll call for the consent calendar? Before that, let me tell you what is on the consent calendar. All right, so on the consent calendar is item number 2, Senate Bill 190, an act authorizing certain foreign educated veterinarians to participate under a temporary permit. Item number 4, Senate Bill 193, an act establishing licensure for long-term acute care hospitals. And item number 9, an act concerning use of funds in the Tobacco Settlement Fund. Item number 10, HB 5165, an act requiring an evaluation and appointment of a receiver to manage hospitals in financial distress or operational crisis. And item number 12, HB 5167, an act concerning the disclosure of water quality test results for certain private and semi-public wells. And item number 15, House Bill 5239, which is an act concerning the DDS recommendations requiring Independent Mortality Review Board and Fatality Review Board. And item number 16, HB 5240, an act concerning the DDS recommendations regarding the various revisions to developmental services statutes.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory,
Senator McCoy votes yes.
Senator Summers, Representative Claire Desteacher,
Summers votes
Yes.
yes.
Senator Summers,
Sorry. Summers votes yes.
Representative Berger-Givallo, Representative Biggins, Representative Carpino, Representative Dauphiné, Representative D'Amico, Representative Elliott, Representative Django,
Representative Jenga votes yes.
Representative Gilchrist, Senator Gordon, Senator Harkadel, Representative Cavros-DeGraw,
Cavros-DeGraw votes yes.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy, Senator Kushner,
Senator Kushner votes yes.
Representative Mauro, Representative Martinez,
Martinez votes yes.
Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Romano.
Romano votes yes.
I did not see you on screen,
Hi,
please.
Hi, I'm here. Romano votes yes. Yep.
Thank you. Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis. Thank you.
For everyone's information, we'll keep the votes open till 3 p.m. We will keep the votes open till 3 p.m. And that brings me to the next item on the agenda, item number 4, announcement of time and date of next meeting and public hearing. Public hearing is on the 4th of March 2026 at 11:30 a.m. in room 2E. And the committee meeting is on the 9th of March 2026 at 11:30 a.m. in an unknown room so far.
Room 1D.
Room 1D. Okay, room 1D it is. And with that, we are going to recess. Thank you.
Just want to make an announcement that the votes will be held open in room 3000 and on Zoom.
Okay, do you have, okay, yeah, I have one, because they're like using, okay. You're gonna put this over? Yeah, could you come over here? Yeah, did you vote?
It's Tracy Mara. I voted for most.
Oh, the last part.
I needed to,
She needed consent, and I think she missed two other votes.
Okay, hold on. This one, this is the consent calendar? Yes. Okay, thank you. Yes. Okay. Yeah, no, health information. Yes. Okay. Yeah, I think you missed like about 3. I got them. All right. Thank you. Okay, you're welcome. Thank you. All right. Who's raising their hands now? Representative.
There's a question. First.
What did I see first?
Just do them and do them.
Okay. Senator Kushner?
Hi there.
Hi.
So, we have to do it all. Can I leave it, Diane?
Yeah, I guess so.
Diane?
Yeah.
You're holding precious cargo.
Kushner, just checking. Kushner. Hold on. Senator Kushner?
Yes.
Act concerning psychedelic assisted therapy plot. How do you vote?
Senator Kushner votes yes.
Senator Kushner, the act implementing the Rural Health Transformation Program to expand healthcare access. How do you vote?
I vote yes.
Actually,
Yeah. Are you gonna go? Are you gonna go in? Are you?
He just said, it's sensitive. I don't know if it was Zoom or Zoom. We had a people, they were working on it before. Yeah, yeah. I mean, it's not surprised, but like I said.
I think we've got them all, Senator Kushner.
This morning, we had just a minor pickup. When, you know.
Kushner.
Our audio that we don't know how.
Senator Kushner, I think
Yeah.
we have we've completed all for you.
I'm sorry, I couldn't hear you.
I think we've completed
I don't know what
all the votes for you.
Okay, if you come across one that I didn't vote for, please text me or call me and I'll get back on.
We'll do so, Senator.
Okay, thank you.
question. If we tweak it for the Zoom, then the room is off. So they're working on some sort of a solution. I don't know all the technical aspects of it, but they're trying to work on a solution where it works for the Zoom and yes. So that's yes. And that's the bane and the beauty of the current system we have. Has people playing. Problem is that their audio
Representative?
different.
Yes.
DeGraw? Okay, see where you did not vote?
I know the first one for sure.
Okay, hold on.
It's Cavros DeGraw, so it's probably under K.
Okay, we've done this one.
You are very difficult to hear, so you're going to need to speak up.
Guys, hold on, please. Turn this up.
I have my laptop turned up to
I
100
can
and
hear you. Just hold a second, please.
no, I know you can. It's the other way around. We can't hear
You
you.
can't hear me.
You're very faint.
Can you hear me better now?
It's a little louder. Yes, thank you.
Okay. Okay, I have an act concerning nutrition and food-based interventions for patients with this diabetes and congestive heart failure.
Yes,
How do you vote?
yes,
Okay. An act concerning emergency medical services response time transparency. How do you vote?
yes,
An act concerning hospital sales leaseback agreement and
Yes.
yes. Along definition. Okay. Okay, you did vote for the consent calendar.
okay,
All right, what about an act implementing the Rural Health Transformation Program to expand healthcare access?
yes.
Okay. There you go. Yeah, here you go. Okay, I think that's it.
Okay, thank you very much. If there's anything else, just text
You're
me.
welcome. Have a great day.
You too.
Oops, admit. Senator Summers. Senator Summers, can you hear me?
Yes, I can. I think I'm just missing number 6.
Which one?
I think it's just number 6. I'm having kind of a hard time hearing you.
Wow. Hold on, please.
Okay, I'm better now.
Okay. An act concerning hospital sales leaseback agreements.
Yes, I'm going to be a yes, please.
Please don't go yes, Senator Summers. Let me double check and make sure. that
Okay.
any other- Okay. Okay.
Regret those words, change my point of view. I don't know if I'm on that meeting, so.
Senator Summers, an act concerning the psychedelic assisted therapy pilot program.
I'm a yes on that.
An act concerning the prevention of accidental overdose deaths and improving access to treatment.
I'm a no on that.
Yeah, that looks like it for you, Senator.
Okay, thank you so much.
Anything that's unchecked, I'll give you a call or send you an email.
Okay, thank
We
you.
don't have a lot of time, but I'll
Okay.
let you know.
Okay, bye-bye.
Thank you.
Thank
Let me go to Gordon first. Yep, let me see where Senator Gordon is. Okay. No, I'm good. Senator Gordon, can you hear me?
I can, thank you. I think I missed the consent calendar and maybe number 17, I don't know.
Okay, we skipped number 17. So,
Oh, that wasn't taken up?
well, we didn't do that one. Consent calendar for, yeah. Senator Gordon, how do you vote?
On the consent calendar?
Yes.
I vote yes.
Okay.
And I think I took care of everything else that number 17 wasn't voted upon.
Yeah, that should be it, Senator.
Okay,
All right, thank you.
thank you very much.
Representative Biggins, can you hear me?
I can.
So let us, how do you vote on the consent calendar?
Yes.
Representative Biggins, the act concerning the secure transmission of minor patient safety plans to schools by healthcare providers. How do you vote on that?
Yes. Adamantly, yes. That doesn't matter, that part.
An act concerning social work licensure. How do you vote on that, sir?
Yes.
An act requiring the establishment of an alert in the statewide health information exchange regarding patients with history of violence and combative behavior.
Yes. I think I voted for that before, but yes.
Okay, this one. An act concerning the psychedelic assisted therapy pilot program.
Yes.
Why did they put two numbers here? Again, yep, you're over here. This shouldn't be- Okay, I think you've done all of them, sir.
Thank you, Dan. Have a good one.
All right. Happy
Bye,
birthday to you.
Patrick.
Hey, MD.
Senator, the last bit you missed. Yeah, I don't think you did the consent calendar.
Yes.
So sorry. Okay, how do you vote on the consent calendar, Senator?
Yes.
An act concerning the prevention of accidental overdose deaths and improving access to treatment and recovery services for
Yes.
Okay. I don't need to read out all of that, right? Okay. Senator, an act requiring the establishment of an alert in statewide health information exchange regarding patients with a history of violence or combative behavior.
Yes.
An act concerning social work licensure.
Yes.
Senator,
Everything yes.
an act concerning the secure transmission of minor patient safety plans to schools by healthcare providers. Senator.
Yes.
An act concerning the nutrition and food-based interventions for patients with diabetes and congestive heart failure. How do you vote, Senator?
Yes. Those all vote, Senator Anwar voted yes. Am I right? Chair, Senator Anwar voted yes, all those?
Hold on, please. Yes.
Okay, good. Good man to follow.
Senator,
All set?
there's, okay. Senator, an act concerning emergency medical services response time transparency.
I can hear you. Sorry.
I don't know. Can you hear me now, Senator?
Yes, yes, yes. Little better.
Act concerning emergency medical service response time transparency. How do you vote?
Yes, yes.
Go a little louder. An act concerning hospital sales lease book agreement and what is this?
Yes.
Attestation concerning lack of private equity control in hospital.
Yeah, that's okay. Yes.
Okay, I have you I have them for you, Senator.
Good.
Senator, one more.
Okay.
An act implementing the Rural Health Transformation Program to expand healthcare access.
Yes.
Okay. Yeah, that seems to be it. Oh, yes, I'm so sorry.
That's it?
I'm here. Sir?
Any more?
No, sir.
Thank you, Diane.
All right, have a good
you.
day.
Hello.
Okay, could you hold a second, please?
Because there's people inside the room.
Okay. All right, we have a few persons in the room. Can you hold a second, please, while we take the votes in front of us? Thank you so much.
Hey, Diane.
She can, yeah.
Somebody else.
Everybody hear? Everyone hear me? I'm not
Yes.
not hearing. Yeah.
Yes.
Okay. I was trying to see if I can do all of them online at the same time.
Diane, it's Representative
but-
Pico. I'm here.
All right, I'm gonna have no, hold on. Representative Collector. Let me do him first. Representative Collector, can you hear me?
Yes.
Gonna do you next.
Okay, I think there's only the consent calendar and maybe one
The
other.
consent calendar that you haven't done?
Yes, I vote yes on the consent calendar.
Okay. Noted. Thank you so much, sir.
I think there was another one though. Did I miss another vote?
Let me look, because it might be more than one. Okay. All right. An act requiring the establishment of an alert in statewide health information exchange.
No.
We're just double checking, sir.
Okay, I think that was it, but thank you.
Fifty-one, 68. Oh, yes, he did vote. Yes, he did vote. He said he thinks that. Looks like you're all set, sir. Thank you so much.
Thank you. Have a great day.
You too. Rep Dem- Rep D'Amico, can you hear me? Can you hear me, sir?
Yeah, I hope you can hear me. That's the
I
most
can
important
hear
part.
you. I
Okay.
don't know what's going on at the phone, but I can hear you loud and clear.
Oh, great.
Okay,
So-
so we have an act concerning the psychedelic assisted therapy pilot program. How do you vote, sir?
Yeah, I'll vote yes.
An act requiring the establishment of an alert in statewide health information exchange regarding patients with a history of violence or combative behavior toward
Yep,
a healthcare provider.
Yeah,
How do you vote, sir?
I'm a yes on that. Yes.
That one was done? An act concerning the secure transmission of minor patient safety plans to schools by healthcare providers. How do you
Yeah.
vote on that, sir?
Yes.
An act implementing the Rural Health Transformation Program to expand healthcare access.
Yes.
An act concerning social work licensure.
Yes.
An act concerning the nutrition and food-based interventions for patients with diabetes and congestive heart failure.
Yes. You're probably going to. Thank you.
An act concerning emergency medical services response and transparency, time transparency.
Yes.
This one you did. I didn't know. Could you hold a second, please, sir?
Of course.
Thank you, Senator D'Amico. Right. It's just a public time. I know all this. Yeah, well, you know how it is with you and him.
These are the stuff on consent, just telling me item number 2, item number this one, all the ones about check.
Just tell him these are the ones,
On
I said. Okay, okay. Rep D'Amico, on the consent calendar, we have, SB 190. Right, an act authorizing certain foreign educators, veterans to practice under a temporary permit.
So if it's a consent calendar, I'll just vote yes on the consent calendar. I trust my colleagues on this one.
Just supposed to read the bill numbers or
Okay,
item.
we don't know.
That's what I was telling you, but you didn't hear me. That's why I checked them.
Okay. Yeah, well, I didn't know I wasn't supposed to read all of it. So, anyway, all right, thank you, Representative D'Amico.
So I voted yes on the consent calendar. Then
Yes.
did you get me down
Yes.
for all the other individual votes?
Sir?
All the other individual votes, you recorded me, I presume?
Yes.
Yes, sir.
Yes, sir.
Great.
Thank you so much.
Thank you, Diane. Appreciate it.
Have a wonderful day.
Thank you, Beverly.
Beverly said you have to have a wonderful.
I'm all set.
Yeah, like how we have the calendar now.
Just put the fields in order for correct.
Okay. Yeah, right.
93, he's on consent, right?
See if I can hear this.
It begins already, so this is, How close are they?
51,
Mhm.
51, 55,
Senator?
51.
Can you hear me?
Hold on a second.
Can you hear me?
Yes, I can hear you loud and clear.
I can't hear you. I'm gonna try to
I
move.
don't know what's going on with the audio on this. I actually brought it all up. Okay. Can you hear me?
Can you
I can
hear
you,
me?
Diane.
Yes, I can hear you loud and clear.
Rep Daphne, can you hear me? It's John Michael.
Yes, I can hear you. I can hear
Okay. All right. I guess Rep Daphne can't hear us. Maybe something's going on with her
Can you
phone.
hear me?
But I can hear you, Diane. Yeah.
I'm so sorry.
Okay, so
We have some
Look at this time on his face.
Okay, so 193 is roll call, 191 is roll call,
Just like a table to sit at.
5 is roll call, 160 is roll call.
Go ahead, Diane.
Okay, one second, please.
Oh, sure.
Yeah,
Thanks.
I have somebody before me. I'm just gonna deal with it.
Understood. Yeah.
Okay.
Thank you.
Thank you so much for your patience.
Of course. Thank you.
Senator, this one, this is HB.
We're gonna do it in order, that's why I'm putting them back.
Oh, okay.
69.
Let's just do the fence. We only have two persons.
I think you have to stand behind so they can see your face there. Okay.
Oh, okay, so all of you can.
Okay. You voted yes on consent already?
No, nothing. Ready?
Let me do that. Okay. All right, both of you can just, yeah, but I still have, Rep. Dawson. Oh, okay. All right, so an act implementing the Rural Health Transformation Program to expand healthcare access.
Yes.
How do you vote, Rep. Daphne? I did.
Yes, so finish it first.
Oh, all of your.
Yeah, do all of
You
them.
have to
Yeah,
do all
you're
of
gonna
it
go
last
faster.
time, that's why I put them in order and give it to you.
Oh, okay. Okay.
First one. The next one should be at 191.
You have to vote after because.
Oh, okay, we have to do one at a time. Thank you. All right. Okay, and act concerning the Saturday.
No.
No.
The next one should be
You did
SB
vote on-
195.
You did this already. You voted or not?
Oh, you took that one from me already?
Yes, you did. No.
Yes. Perfect. SB 196.
This one you didn't vote. This one,
No.
no. This is, yes. How do you vote?
No. Yes.
Yes, and her, and her feeling.
Thank you, Peter.
Social, yeah, life
Social
insurance,
work, yeah.
deleted,
Yes, yes.
yes.
Hmm?
Mhm.
5168.
5168,
Yes.
yes.
Yeah, he's working on.
5169.
Yeah, no, okay. And then the consent calendar?
Yes.
Yes. Okay. All right, you're all set. Thank you so much. for your patience.
No problem.
And let's keep him in order.
I'll go back.
Thank you so much.
Somebody's back in here.
That item Martinez, it's not gender, so it makes it Martinez.
Parker, can you hear me, sir?
I can, Diane.
You can?
Yes.
Okay.
You're good.
Number one.
You're good.
Okay. I'm taking this up.
Item number 1, Representative Parker, how do you vote?
Yes.
Okay. Bill number 191, how do you vote?
Yes.
Bill number 195, how do you vote?
Yes.
Bill number SB 196, how do you vote, Representative Parker?
Yes.
SB 238, how do you vote, Representative Parker?
Yes.
SB 239,
Yes.
HB 5166,
Yes.
HB 5168,
Yes.
HB 5169,
Yes.
and for the consent calendar, how do you vote?
Yes.
All right, you seem to be all set. Representative
Thank you.
Parker, thank you so much for your patience.
Thank you, Dan. Thanks for your work. See
All
ya.
right, thank you so much. Bye.
You get cut off me. He left.
She's right there. Rep Daphne, I thought you left. Thank you so much for your patience.
I'm sorry, I'm in a bad spot and I'm trying to get in a spot where I couldn't hear you and I wasn't sure if you could hear me. And anyway, I don't unfortunately have the list of bills. I only have the numbers. I didn't. So if you could go in order of that, that would be helpful.
Yes, I'll do that. Okay.
And I'm not hearing you really loud.
Okay, I'll try to be louder. I don't know what's going on with the volume here. An act implementing the Rural Health Transformation Program to expand healthcare access. How do you vote? She's gone. All right, we're gonna go to Senator Slap. Yes. Senator, can you hear me?
I can barely hear you. It's very faint.
Goodness, why are they barely hearing?
If I go this close, how loud is it if I'm asking?
Oh, why is it so low? We just have 2 more persons. Let me just raise my voice. All right. Senator Slap, can I Senator Slap, may I just do Rep. Daphne Schwartz? One person is in a very, very bad situation.
Hold on, I lost you because there's a mic open. Go ahead, Diane. Try again now.
Oh, Okay, yeah, but she, okay. So which one are the first?
Can you hear me?
Okay, Rep. Daphne, could you,
Yeah,
are you ready to hear the?
I am, and I
Okay.
apologize. Yeah.
No problem. An act implementing rural health transformation program to expand healthcare access. How do you vote?
That was number 1, correct?
I think so. Was that
On the
number one?
agenda. I'm following the agenda and I only wrote the
Oh,
numbers.
Oh, you have the agenda now. Okay. Yeah.
Was that number 1, ma'am?
This is number 1, right? Yeah, that's number 1. Okay. Yes, Representative.
Yes. Yeah, I'm a yes.
This is number. SB 191.
Is number 1 on the agenda? Yes.
No, we already did number 1.
Oh, okay. That's number, what number is that?
I guess it'll be.
I'll have to get off and rewrite the bill numbers by the numbers if I do that.
Number 3.
Number 3, yes, I'm a no.
Bill 195.
Is that number 5?
5.
A no.
$196.
Is that number 6? Number 6? Number 6, I'm a no.
This one is the emergency medical services. What number is that?
That number 7?
Number 7. Yes. How do you vote
Um,
on that one?
A no.
Okay. Yeah. Don't tell me what number corresponds to the SB 239.
That number 8?
Number 8.
Yes, I'm a no. Thank you.
HB 5166. Number 11.
A no.
HB 5168.
Number 13.
Number 13.
I'm a no.
HB 5169.
Number 14.
Yes. How do you
I'm-
vote on that one?
A no.
Okay. And for the consent calendar,
I'm a yes.
you're up?
Yes.
Okay. Thank you so much.
Thank you for your patience. I appreciate it.
Thank you for your patience. All right. Have a great day. Senator Slav?
Yep.
Sorry for the delay, sir, and thank you for your patience.
Okay. So,
All right. So this is SB 93,
yes.
the first bill, yeah. SB 191,
Yes.
which is number 3, yes. SB 195,
Yes.
number 5. SB 196.
Yes.
Seems like he hasn't. SB 238.
Yes.
SB 239.
Yes.
HB 5166.
Yes.
HB 5168,
Yes.
HB 5169,
Yes.
and for the consent calendar, Senator, how do you vote?
Yes.
I think you're all set, sir.
Thank you.
So much for your patience.
Thank you. Have a good day.
You
Bye-bye.
too.
Who didn't vote no? We don't know, we have to go upstairs because they announced that it's upstairs. So. For the moment.
Rap Elliott?
I can hear you.
Hi, how are you?
I'm doing great.
All right. Do you have any documentation before you regarding the bills that you're voting on?
Nope.
All right. So we have the consent calendar.
Mm-hmm.
How do you wish me to record your vote?
Yes.
For SB 93,
Yes.
SB 191,
Yes.
SB 195,
Yes.
SB 196,
Yes.
SB 238,
Yes.
SB 239,
Yes.
HB 5166,
Yes.
HB 5168,
Yes.
HB 5169,
Yes.
That's it, Representative Elias.
Great. Thank you so much.
Thank you. Have a great day.
You too.
Yeah, I'm not gonna I'm not gonna like count down. Mhm. People pick out the ones they're gonna work on. Okay. Okay, so put your name in there twice? No. Oh, now are you gonna pick twice? Are you gonna pick twice? Because Bev would want you to pick twice. I think she'd want you to pick twice. No. I actually have a training for JF on the 10th. Why did, yeah. But nothing, no, it's just to cement anything. I have a document, I can go through that just to see and stuff. It won't, but in terms of, yeah. Mhm. Read those and you put them on. Mhm. We're not trying to eat. We don't want to hold your pen, Peter. We don't want to hold you. Alright. We just have a few minutes. We just have a few minutes. Mhm. Is that a different language? Okay. Okay. I don't know fully. No, no. Eh? No. The issue was I couldn't hear the YouTube thing because there was a.
Oh,
Yeah.
that's a CCN.
Yeah, that's the CTN thing.
Oh. Oh, because here's a joke. I don't remember. Oh, the joke. Here's a joke. You said a joke.
Oh, hello.
I think it was like, oh, it's issue. The word. You wouldn't be able to.
Oh, okay.
It was a joke. It was a joke.
Okay, thank you so much, Peter. I'll text you something. But I'm still being mindful. Okay?
Say I'm free. What do you do?
Oh, you're free today? I need to come see your dad. So that instead of you coming here, I can come over there to you. How about that? Or you don't want me there and I'm afraid to say? You're afraid to say, don't come over here. Is that what? Huh?
Barely at my desk, so
Yeah?
I walk around a lot.
Okay.
Probably gonna go to AJ.
Oh.
Capital.
Okay.
You know,
Yeah, definitely. Thank you. Bye, Peter. How many in that bin? Yeah, how many numbers in there? Okay.
16, but I already took out 195.
Oh.
What
is it?
195.
Oh, is that a big one? Oh, yeah, she said she loves doing them, so. Okay. Huh? Yeah, she's there.
Abigail, you're writing day off before. I know that's just so opposite right now. So you have.
There you go. Kathleen works in the legal firm.
You do?
In her spare time.
You do? I can come. You do?
I don't know we can, but I'm saying no.
Ladies first. Let me know what number it is. What is this number?
I knew you were gonna, it's 2:30. Did you want to?
Yeah, I try to make everything.
Oh, there you go.
So, not that the actual thing is fun. I have to find an aspect of fun to it.
Here.
This is my office.
That's my saving grace.
Okay. Okay, so now report to Sally with your numbers. All right. And we actually.
Abigail, what do you have? Doesn't take more than half a percent. Kathleen?
Everybody coming on. Because some people coming on that they are coming on at work. Those are all house bills?
Well, those are all, sent with. So. I'll do it with everyone. When you look at them, you'll see what you got.
Thank you, Dave. Maybe that sounds like a nice strategy. I think it's because she likes Beth that much. Yeah, Hackadown, no. Hackadown, no. Oh, okay. Yeah. Yeah. I was wondering too. What that do? Okay. Elliot probably. No, Elliot did vote. Oh, he did. Okay. All right, I feel bad there. It's only one person, I think. I have only one. Yeah, just one person didn't vote. Just one. Just one, so just her okay. 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 Who? 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 That's Nelson. No, she voted. It's Hackaday. No, but I did get votes from that one. I spoke with her. Yeah, okay. But I didn't get any from Hackaday. Yeah. Yeah. Tamar, I didn't vote on can we cross out Tamar? She didn't vote on SB 191. Senator Marks. She didn't vote on SB 191. I can get somebody. I can get somebody. Hold on. Brianna. She was there, and it's just that she missed that one. This is yeah, but this particular one of them she missed. No man, she missed two. She missed another one. She missed 93 as well. 93 and 191. I think that's closer. Senator Marks? Yes, ma'am. Yep. Okay. Okay, I was just calling our people from across this one.
Just to let you know, on our pen drive, there are documents with their personal cell phone and stuff.
Okay.
I'll show you how to access it.
All right, thank you. You should have 93 and 191. Senator Marks, can you hear me?
Hey, Bev.
Hi, this is Diane. You missed a couple votes, Senator.
Yep.
SB 191,
Can you just repeat the title?
Act concerning the psychedelic assisted
Oh,
therapy pilot
yes.
program.
Yes, yes, yes.
Okay. And you have 93, SB 93, Act implementing the Rural Health Transformation Program to expand healthcare access.
Yes.
1 second, Senator. Just let me double check that you didn't miss anything else. You're all set, Senator.
Okay, much appreciated.
All right.
Bye-bye.
Take care.
Bye-bye.
Ben? Oh,
She's on the phone with IT.
okay.
Can you wait a bit?
You have a number for Gilchrist? Gilchrist. Representative Gilchrist, you have a number for him? Well, she said it's on the, she said it's on, okay. What? Member, yes, member. Police report on membership, personal contact. Where? Okay, hold on. Okay, I'm good, fine. You.
In the couple of people who give her phone call for help or anything. I'll email you. He's no longer, go back to the document, go back. That's the 2019 list. Most of these people are no longer. This is from 2016. Come, let me show you.
Yeah, I know what to do.
I thought since you guys have been such a long time here, I thought it might take a little.
Oh, this not updated? You try this on. Will this be beside the photos or no?
No.
Mhm. Okay.
In that folder.
Oh.
And then those.
Contact information.
Yes, and it was updated in time, and the only person who's not supposed to be on there, maybe 7-9, because of the mistake.
Number check listed. Yes, check list. No worries. Contact.
That's when they had submitted the form. Let me look and see what it's in there then.
Three o'clock. Yes. Should we just let it go now? No.